Dun, 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 dun. Everybody likes that music. I feel like Joe. Remember? The bartender? Jackie Gleason? Remember? Frankie Fontaine was the customer. Jackie Gleason was the bartender. Hiya, Joe. Hiya, Mr. Donaghy. Do you remember that? Is anybody old enough to remember that? Jackie Gleason? Anybody remember that? Start off the show, wiping down the bar. Hiya, Joe. Hiya, Mrs. Donaghy. That was, yes, that's right. Let's see. Lots going on today. You do? Mary Murata remembers that. I guess, you know, you had to be a 60s kid or something to have watched that. Actually, although I think that was actually in black and white when that first came on, the Jackie Gleason. And then he would start off saying, but remember what a good singer he was? Huh? Remember that? Mrs. Donaghy. See, some people remember that, right? We're back, and it's Friday. You made it 9 weeks. I guess it's technically 10 weeks, but 9 weeks, and you made it. And so you should prepare yourself a citation or a special... What do you mean? Are you downstairs? I need food. Pamela, are you downstairs working? If you are, tell me yes. I need food. Yeah. Hiya, Joe. Hiya, Mrs. Donaghy. Right? Good stuff. That's when it was good TV. What's a drive-through thing? I'm not sure what anybody's talking about. If you have a chance, will you stop down on the first floor when you have finished upstairs? Sure. I just don't know where you are. Downstairs could be like, here, it's like we're on the 3rd floor, but technically we're on the 2nd floor or something like that. Or, I'm not sure. Let me know where you are. Okay, hey, let's get things started because we made it 9 weeks, and give yourself a little tap on the shoulder, a cheer to you, a little salute that we made it, and we are mostly sane, and hopefully you're healthy, and you know, it's just think. I mean, we got to like attack the summer with masks on. I don't know. Somebody tell me. I'm sure somebody will share their opinion with me. Ron is a drive-through. I'm not sure. Where everybody's? Oh, 4:35. You got food down there tonight at 4:35? What do you got for food tonight? Tell everybody. This is a chance. This is a chance to give yourself a plug at 4:35. I'm trying to help you out here. So here's what I did. So just so happened, hey, anybody, keep your eye on the weather. I guess things could get. So I'm not sure this might like put me into the ICU, but so I took my Blistex, and I imagine you could do it with other things. I put a little dab right where my nose is, because I don't know. I was just smelling me, I guess, right? Yeah, Frankie Fontaine, Joe the bartender, Crazy Guggenheim. And wasn't Frankie Fontaine, didn't he really sing well, right? Wasn't he like he had a really nice voice, right? Yeah, so I just put this on here. Visit our website. I'm trying to give you a plug here. Tell us what's cooking down there, Pamela. I'm coming down after. I need some food. Is that other door open as you go downstairs, or do I have to go all the way around and all that? Let me know. So anyway, I put a little dab right there. So I did the old safety check, and it makes it so much better. And that's just by doing using a little bit of medicated lip ointment, Blistex. And I'm not sure, maybe I was going to say Vicks, but I probably get yelled at for Vicks, because you're not supposed to like inhale Vicks, I guess, something like that. So I want to make sure that Vaseline on the top lip will help with the smells. Yeah, but Vaseline doesn't smell. I don't know. I'll try it. I'll try anything. Anyway, it helped me through the days. A little dab of Blistex or anything, I assume, that you like to smell. Maybe lemon or lime or something that you can do. I don't know. That's just me. Anyway, over the weekend, emergency management will be up in the mornings. If you have any questions, 978-534-7500, extension 5055. If you'd like to volunteer and you've got extra time and you'd like to volunteer, it's a great place to volunteer. Ask for a tour, and they'll take you around the building and show you the different components. And you'll find some really talented people there. You'll be impressed. Hey, we need somebody to do a drone flyover of Shoalin Farms. I would assume tomorrow or Sunday. I guess, what's going on? You got one? You already did it. Awesome. Did you do a drone? Oh, awesome. Nice. But I guess the flowers, you know, it's out, right? Everything's sort of budding. Hey, is there something missing to my left? There's like part of the building's gone. Was there something there? A camera, maybe? I don't know. It's like the whole thing is empty. Yeah, mint. I did it the other day. I did it at the gardener spot. I took a little mint or whatever it was, and I put it in there kind of until it came to an oil, and I just kind of rubbed it over there. So it makes it a little easier. So yeah, emergency management, if you'd like to volunteer, maybe you stop down. They'll give you a tour, and you'll find different components and the different aspects of emergency management, and you'll be pretty impressed. And so many have found a rewarding place to fulfill their passion to help neighbors and community. State assistance, again, we just keep doing this. I do find a little bit of a challenge for those. So it's not easy for those with a language barrier, and we speak many languages here. And a gentleman came to my office today, and he worked at a restaurant, and he was let go, and I don't know what let go meant, but definitely a language barrier. And he wants to work, but it's difficult for people who might not have the internet, because what we used to do is send people over to the library, and the library is now closed. So people say, well, they have free Wi-Fi. Well, it doesn't help if you don't have a computer. So it gets a little more difficult. So I'm going to call my friend over at Mass Hire and see if Mr. Roberge could help us out with this gentleman. He seems like, he stood out front for I don't know how long, because he wants a job. He wants to work, and got let go from his job at one of the restaurants. And many times language barrier is exactly what it is, a barrier. So we want to sort of explain to as many as we can, and if you can get to unemployment benefits, and sometimes people qualify for unemployment benefits, and they don't even know. They're legal citizens, just have a little bit of it. And I could clearly communicate with them, but it was, he struggled a little bit, but he did well, and I complimented on it. He said he wants to learn to speak English better, but good guy, just in conversation with him, and so it's the kind of person he'd like to help out. So mass.gov/DUA for unemployment benefits for those who are self-employed, mass.gov PUA, that's /, and don't forget the SBA Paycheck Protection Program and all of that. So this weekend's a good weekend to go to our website and fill out all those grants. If you are a small local business, we want to help you out with that. And then on Monday morning, if you have any questions, call us at 978-534-7500. What are you going to do this weekend? I know it's nice today, maybe cooling off tomorrow, but it's the weekend. It's been 9 weeks. For some, working at home, having kids run around the background, chasing each other around with, whatever, right? Playing tackle football in the kitchen. Been a little bit of a struggle trying to get them to get into their lesson plans, right? All of that. So what are you going to do this weekend? Are you going to sort of self-contain yourself some more? Do you have errands that you need to run? Do you need to get to the supermarket? You notice there are less people browsing around comparing prices on an 8-ounce can of beans and a 10-ounce can of beans. There's a lot less that going on. People look like they're getting in and getting out. Nancy, I thought the same thing, because I think the cure to everything in the entire universe is Vicks. But if you read it, it says not to inhale Vicks. So I imagine a little dab of it. I'm talking like a little speck of something right where your nose area goes, and you will be in good shape, right? Okay, so what's going on tomorrow? Ginny's Food Pantry is open 11 to 1. Yeah, I'd say, I would say you could start to look in your garden. A lot of people spend the time in the garden, and there's so many websites that you can go to, but we're zone, what, 5.5 to 6, right? Is that what we are? So you can go and find out what you can plant. My grandfather always held off planting tomatoes and vegetables, most vegetables, until, unless there were cold weather, vegetables like peas and those kinds of things. He always held out till Memorial Day, because you could get a frost, and then it's just everything would be gone, and you'd have to replant it all over again. So I'd say maybe you start to get some plants hardy. Maybe you have plants growing inside. Maybe move them outside. And I have another question. So this is the question somebody asked me, and I said, geez, I don't know where to send you for this, but where do you get good compost? Not in the bag that they sell it, you know, because I don't know if there's anything in there. They sell like potting soil in these big bags of something, and it looks to me like it's debris from transfer stations, and they grind it all up, and I don't know. But where do you get good compost? Like good stuff, you know, that it's like black gold. You can see, you could throw a seed at it and it start growing. Where do you find that? I'd like to know. Yes, see, you got it, Marilyn. Vicks fixes everything. Hey, they're having a beautiful day out in Phoenix today. Alan Gallagher sort of weighed in, and I don't know where you're watching, but let us know if you're out of state. Let us know what the weather is like where you are, and yeah, so we got to watch out. Yeah, got to watch out for the frost. Could still get frost. So Ginny's Food Pantry tomorrow, 10 to 1. They're very organized, 978-537-1387. And storms and a tornado potentially tonight, right? Is that what they're saying? All this humidity all of a sudden. We went from like 20 below yesterday to all of a sudden, there you go. So there's on Route 13, there's a farm going into Townsend that has a sign, black gold. Okay, I'll check it out. I want some for myself too, but around here I didn't know. I don't think like Gove. If Gove has it, he probably has it for himself, or they have it for themselves. And I don't know, anything that's kind of prepackaged is, you know, in Canada, if I'm correct. In Canada, I'm told that they cannot use pesticides. So everything that they have is pesticide free. And there's also a product, and somebody was asking me about bamboo the other day. How do you get rid of bamboo? Well, bamboo's not easy. You got to keep spraying it a number of times. And I know sometimes people will say what is it, Roundup. But then there's all those like health concerns with Roundup, so I'm not sure about that. But you know, if you hit it with enough applications of Roundup, I guess it'd kill it. But there is something they make in Canada that takes bamboo right out. And I think you still have to apply it a couple of times, but it's all natural, and I'm not sure what it is. And I know you can use like a vinegar. There's always those mixtures of various things that you mix together to kill those kinds of things. But from what I understand, there's a product, and I knew the name of it. I actually have it saved in my notes, but then my notes went over to a different system, and I'm not sure it took it. But anyway, it's made in Canada, and it's pesticide-free. It's all organic, and it kills anything. So if anybody knows the name of that, let me know. Yeah, but still, I think they banned some of the ingredients to Roundup, but I believe you can still use it. But you have to see, that's the problem is now they ban certain ingredients, but then they have to use more of it. So people will use more of it. So rather than one application or two, they'll have to hit it now and then later on in the summer and then probably once in the fall. But bamboo is tough to get rid of to begin with. Speaking of things, let's give you some updates here. Yeah, well, not right now, but if you call on Monday, if you call my office and ask for somebody in the treasurer's office, they will help you with your excise tax, okay? So just call my office. It's easy to do that, 978-534-7500. And let's look at the state numbers while we're, I had it right in front of me from yesterday. Total cases in Massachusetts gone up 1,239. Total deaths gone up 110. Total tests have gone up 11,300. So almost every day now, we had a little bit of a lull. It was like 8,000 tests per day, but they're up to 10 and 11,000 now, over 11,000. Worcester County cases are up 231. 3% hospitalization rate, and I expect that next week we will see that rate drop. So 3% hospitalization rate, and we are total deaths 110. So, I mean, all you have to do is open the newspaper, and all you have to do is open the newspaper and see the number of people in this area, North Worcester County, and then you can see the Telegram in the morning, and then obviously the Boston Globe, and then on Sunday it's frightening for all those people that we've lost, many veterans. Yeah, just a terrible thing. Mr. McDonald was laid to rest over there at First Baptist Church on the corner where he was active, and I looked over, and you know, they only allowed a certain amount of people to go into the funeral, and here's somebody that's been around for a long time, served in the military, active in his church and his community, ran a business, pretty good sized family, and you know, limited as to how many people could pay their respects, which is something that we've done. I guess, you know, down the road, you know, it used to be, I remember when I was a kid, they actually had wakes in people's houses, but it was 2 to 4, and then 7 to 9, and they'd actually do it 2 days. I mean, that must have been brutal for families. I remember as a kid, you know, some relatives passing away, maybe my grandmother or whatever, and having those wakes 2 days, 2 to 4, 7 to 9, or whatever it was. And I was thinking, that's just a lot. So today, by people's request, they have, I've been to a number of, they didn't have wakes, but they had a funeral service. Then they didn't have wakes, and then other people have sort of a ceremony in the funeral home. And then I've been to services where there's nothing, where at the request of the person, the deceased, they requested nothing, and many times it's because, you know, the impact that it has on the, you know, on the family, and it's a hard thing to go through. But I don't know, it's something about closure, right? So anyway, that's where we are. I will go back. I need to, hey, thanks, Brad. I love this battery. I got to get me myself one of these, as they say. Let's see. Let's go back to my page and just check to see if the afternoon rates are in for Leominster. Of course, you got to punch in the right password in order for it to work, and there aren't. So I'm going to go back to our website. To our site to see what's happening here. Vinegar, digging, and mowing. Yeah, no, I mean that's really the way to do it, but it's work, right? If you dig out those roots, for the most part, they do work. So yeah. Hey, don't forget, Sonny's on tonight. In case anybody didn't know, Sonny's on tonight, 7 to 9. He plays all them oldies. I lost myself, guys. Let's see how if I can reboot myself. I guess not. All right. Are we on? Doesn't show. But that's okay. I don't have the numbers for Leominster yet. Yeah. Okay. So anybody knows where we can get that good soil? Let me know. So hospitalization rate is down. Let's go to some slides and see where we're at. COVID cases, similar populations. Some are a little smaller, some a little bit bigger, but we're all in that 200 to 300. And then it jumps up in the 400s around Billerica, Salem, into 500s when you get into Beverly and Fitchburg and Attleboro and Weymouth and Marlborough at 700. Then you kick into the 700s with Marlborough close to 700, Holyoke, Braintree, Methuen, Taunton is how they say it. And then you get into almost 800 in Randolph and 809 in Peabody, and then it just skyrockets up in Everett, Revere, and Chelsea. And I am interested in that because those are the locations that chose to go to a complete lockdown. So it's hard to say whether those numbers reflect any kind of, you know, did it help? Did people listen? How enforceable was it? But they didn't even want you out of your house to get a lunch for your kids. They wanted you a complete lockdown. And judging by those numbers, I don't know that it helped. The trend was there, but by then, you know, after 14 days, you sort of look at it and say, when was it that the governor wanted us to start wearing masks? Wasn't it May 4th? So has it been 2 weeks? Has it been 14 days? Anybody remember these things? Let me know. when was the first day that in order to go into supermarkets and everything that you were mandatory that you had to wear a mask? I'm interested in that. Let's go to the next slide, and we talk a little bit about the governor's update, new testing. We're going to see more and more testing sites. There's actually a map on the state website that you can see the testing locations. 10.5 million PPEs distributed. Testing plan submitted to the federal government. It's expanded. I know the president was saying they're talking about millions of people being tested. They're going to be talking more. I think there's so much emphasis on that 18th, where everybody's watching that date, the 18th, to say, okay, you said the 4th, and then you moved it up to the 18th, and now it's almost the 18th. What's going to happen? And I think the governor was probably saying, well, I picked that date as I'll update you on that date. I'm not sure. Some things may open, and then other things may not. But I think, yeah, May 4th. So we've been 2 weeks with masks, right? Right, since the 4th, and 7 is 11. Yeah, well, not quite then, right? Not quite. So Monday will be 2 weeks. So we should be able to look back and see how effective that was. But clearly testing is identifying those that have the virus with symptoms and those that have the virus without symptoms, right? Which are both important. Okay. I'd like to read your little comments here. Different phases that the state will be open. So all eyes will be on the governor's press conference, and we will interrupt whatever it is that we're doing and share it with you in case you miss it on whatever application or news channel that you get. So there's the phase 1 opening, if you want to sort of show that again. Phase 1 opening, all businesses are asked to comply with the following, right? Nothing's changed much. 6 feet apart, face coverings, provide hand washing capabilities, sanitize regularly, training for employees. Pretty much all set, right? I mean, that's pretty much what it's been. So this is important, and Wendy Weeks is the grant administrator, and so this is where her focus has been. She turned in a grant with the assistance of the fire department yesterday on a fire grant, and so here's where the focus is now on that. As you can see it right there in the second line, almost $3.7 million in related COVID impact to the community, and that's the amount that we'll be looking for. That's the amount they tell us that we're eligible for. But now and we've been keeping good track. We've asked all departments since day one to keep good track of what your costs have been through this COVID-19. And so very important. And we're hoping to get every penny we can from that federal money. It's obviously extremely important for us to get those dollars back here in the community. So I looked at the CDC guidelines today. These are the guidelines put out, and I would say conservatively, like on this side, it's May 15th. I'd say as we see the numbers drop, if they drop at the rate that they're dropping now, I think we're going to be okay to open our schools, although it may be a lot different, and I sort of kicked out some ideas. So don't anybody run off and say, Mazzaro said we're going to do this, Mazzaro said that. I said, no, I think we should prepare, and we should be ready to open our schools and have a number of options ready and ready for review. Remember, we're under a state of emergency, so those plans would need to be reviewed by emergency management and other city departments, health department, EMS, fire, et cetera, right? So I would say that maybe it's not going to look like it did when it closed the second half of this year, but there are a number of things, a number of technologies to sanitize buildings, so many services that are out there to help deep clean rooms and buildings, and we're all sort of in that mode now where we are using masks and the numbers are dropping. So I would say a couple of different options, and we'll watch those guidelines with the CDC. And maybe it's a morning and an afternoon session. I used that as an example this morning. Remember, our buildings are our buildings. There's nobody in them. They open at 6, 7 o'clock in the morning, and custodians take over at 5 and 6, and I don't assume we'll be doing too many athletic programs in the schools, right? I don't assume at first. You know, you may want to ease into it, but we own the buses per day, so that's another sort of sticking a feather in our cap. We used to have to pay for the buses per use, and then we went to the bus company. We went on to bring students to, I think it was a museum or Merrimack Valley Symphony, whatever it was, and also to Fitchburg Museum and Art Museum, and they told us, you know, we had to pay extra, and then we said, okay, and then as soon as the contract was up, we put it out to bid per bus per day. So if we wanted to move those kids in and around the city, or even a short trip to Worcester or Fitchburg or Lowell for other activities and class trips, we own those buses. We own them for the day. And so that has really helped us in the long run because, as I said in the past, everything was buses plus. So school day plus anything that happened after 9 and 10 in the morning when students were delivered to school. So anything that happened from the time students arrived and the time we picked them up was extra money. So, you know, it may look a lot different, but I would say we should plan for school to return in September, just like the song, I will see you in September. Okay, Wendy's sending over the afternoon numbers. There are new CDC guidelines for the workplace. Again, should you consider reopening, nothing more than what we've been talking about here, about putting your own plan together and sharing that plan and educating everybody on what that plan is. We've actually looked at the possibility of building a small outdoor office at City Hall where, you know, it's been working well lately where we actually greet the customer in the parking lot, but if we could do something a little more official, you could call ahead, you can, you know, show up to this outdoor office, tell us what it is that you need. We'll pass the message off to somebody inside. They'll bring it outside. You could sit in your car if you want, like a Sonic, right? We might even deliver a frap. Is that what they call? Hubbard's in Princeton. That's what I've been told. Hubbard's in Princeton. Okay, so let me just go back to Wendy's numbers here because they're on a different slide and see what they are. Okay, so local numbers. We are now at 215 current, so we're down 1, and 209 complete, and that's up 10. So a total of 424 since the day this all started 10 weeks ago. And so we are at 215 for those testing positive and in quarantine, but not yet without symptoms for 7 days. And then we're at 209, which is down 10. That's a good number, down 10. And those are those that had tested positive, but now have been symptom-free for 7 days. We'll go back to that slide there if we can. And I'll go back to the screen here so I can see anybody's comments. There we go. Okay, so Wendy, thank you for posting those numbers there as well. So not much has changed, you know. If you're sick, stay home, right? That's important. You know, if you can get one of those thermometers and take people's temperatures when they come in. I was kind of a little weirded out at first, you know, with going somewhere and having them sort of take my temperature. A little invasion, I guess, but yeah, I warmed up to that. You can always take your temperature before you leave the house. I mean, that's, if you have a thermometer, you can find the thermometer. Or you can do the old, you know, you feel my forehead, I'll feel yours kind of thing. I don't know, whatever works. But anyway, we don't want anyone to come to work sick. And so there aren't many other things out here. If somebody's sick, how to handle it, encourage social distancing. You know, so they're in an office setting, there'll be less sort of visiting, right? You don't want people going from one office to the other unless it's necessary. You have these shields up at customer service, and you want people to be behind them for their protection as well as the customer. So there are a lot of things that will change, but you know, there's the CDC guidelines for restaurants and bars, and so this is all on the CDC website. Should you consider opening, promote proper hygiene, encourage social distancing, look for signs and symptoms, encourage people that are sick to stay home, regularly communicate and monitor developments with local authorities, monitor employees' absences, and have flexible leave policies and practices. So pretty much all the same. And then we have youth camps here. And again, it's pretty much everywhere you go. It's nothing new. It's just going to be part of our culture now for a while until there's a vaccine. And then we'll have the big debate about who wants the vaccine and who feels as though there are side effects to it. So then there'll still be people out there. So this isn't going away. I mean, I'm being optimistic, but you prepare, right? You're going out to a storm, you prepare. Winter's coming, you prepare, right? You plan and prepare. Well, we're going to have to deal with this for a while. And yes, we're going to have to do these things. And who knows? Maybe it'll make us much healthier for a whole lot of reasons. They even have a guideline on mass transit. Nothing any different here. Everything's pretty much the same. They just changed the title. Okay, this is what I want to show you. So this is where you find our grants. In particular, this is where you find the CDBG grant, the $2,500 one that the city is giving. When you go to the website, that's what you're going to see. Right in the middle. See where that arrow is? You just click on there, and it's going to take you to the application and fill it out. Put it away for a while if you're getting frustrated. Take it out again, fill it out, some more. And then on Monday morning, we have a number of more than willing team members who will help you out with filling out those. They're masterful. They're experts at filling out forms. So make sure you do that for this weekend. Very important. I'm just going to go by these. This is that grant, what it's all about. All of this you can find on our website at leominster-ma.gov. Here's some more information to qualify. It's a micro enterprise fund, or you could qualify under a small business having a number of employees where at least one job is either retained or created, and it's by a low to moderate income employee. And so all you have to do is look down there to see that, well, one person, low to moderate, is $49,700. So a couple of things, like you have to be a Leominster business, you had to be in a business for a year, right? All of these things, fill it out. Just fill it out. You can't be a nonprofit. You have to be a for-profit business. Yeah, I'm not going to bog you down with this, but you can visit our website and tell you all about this. But it's $2,500 for each qualifying business, so you won't get less than $25. Yes, we made it to Friday. I never gave much credence to that whole thing. Thank God it's Friday, because Friday just, it was like, yeah, but I've got things all weekend, and now the goal is to make it to Friday, right? And then there's still things to do on the weekend and still work. And I will tell you, when I first started as mayor, I was having this conversation on Wednesday night. I said every single thing had to be done separately. If you're waiting for a fax, you waited in the office, whatever, we'll send it to you. Could mean anything, right? We're going to send it to you. And Friday night you're waiting, so that you check back like a million times on Saturday. And if you needed to use your computer or send an email, you had to go back to City Hall. So you basically had to stay at City Hall all of the time. Phone calls came into City Hall. We had text messaging, but that was alphanumeric, and you can only get so many symbols in there. And we'd pull over to use our calling cards at the phone booth. And look at today, every single thing is on my phone. Everything is on our phones. It's just incredible. Here's our Worcester County cases, clearly coming down. We're down to May 10th, and you see the cases to the right clearly coming down. Daily and cumulative confirmed cases, and you go down. More testing, that's what that line does. And then confirmed cases, they go up and they go down, but they're pretty consistent. You know, they're around 1,000, and sometimes they've gone up to 1,300 and 1,600, but you know, that is how it all works. Testing by date, more and more testing. And today, obviously, today and yesterday, there were 8,000 yesterday, but the other day we had 11 and 12 and 14,000 on the 8th. So making a big difference when you can get that testing done. Case and case growth by county. We're down there. I know you can't see it, but we are Worcester County. We are that, trying to think what blue we are there. The county at the very end. I can't quite see. Things shaping up. There was a lot more dark blue before, and a little bit more of that medium Leominster blue, and then The light blue is pretty consistent with Barnstable County in there with them as well. Total cases hospitalized, down. That's a significant drop at 2,859. That's 3% that test positive are hospitalized. So that's a good trend. Total deaths confirmed, not a good trend, but still down, but not, not down to zero where we want to see it, 5,482. Average age right now at 53 years old, and you can see to the left, age groups by category, everybody gets it, and but then when you see the sort of age per 100,000, it just really spikes at 80 plus. And then you go with the hospital and hospitalization rate. Average age right now is 68, so that's actually gone up from 62, was it? And then the deaths have stayed pretty consistent at 82 years old. Yes, younger people get it. You can see to the left, but they don't die from this. And I'm not saying none do, but I'm just saying look at the graphs right there. And then the rate per 100,000, again, very minor until you get up to almost the 50s before it even shows up. And then when you hit the 70s, 79s, it increases. But when you hit that 80s plus, you're up to more than half of the people who have passed away 80 plus years old in nursing homes, etc. There you go. Male, female, share it pretty evenly. Those deaths with previous hospitalization, 56%, and those with underlying conditions, asthma or cancer or whatever, it's high. It's at 98%. Terrible, terrible, terrible. I don't know the answer to that. How many people do you think there are in the United States without comorbility? I don't know. I'm not sure. I Google that real quick. I'm sure they'll tell you. And by death by hospitalization cases, hospitalization, and deaths by ethnicity and race, clearly there's something to look at. And maybe it's communication, getting the right information out, language barriers, whatever it might be, but that's pretty significant. Long-term facilities, there we are, 3,338. There we are, hospital capacity right now. There were 30 in Leominster Hospital last time reported, and I think 7 or 8 in ICU. So those numbers have gone up a little bit. And there we are, total hospital capacity by region, and we are included in the Central Mass, North Central Mass, I guess is what you'd say, but Central, see to the right there, so 2,100 beds. And if you need to get tested, there are some conditions, and they're listed right there, so you need symptoms. If you need to get tested, you go up to the hospital, and they'll be there 10 to 2 this weekend, 8 to 4 on weekdays. And also at Reliant, call ahead. They'll ask you a series of questions and then tell you whether or not you should go for testing. But remember, the other piece of this is you need to be a Reliant customer. Local update. I think the only thing that's pertinent to right now is the recycling event that was supposed to happen tomorrow has been postponed. We moved that up. And then also Starburst has been postponed till the 22nd of August, and graduation August 1st. And if you haven't paid your tax bill, June 1st is the deadline. June 30th, if you're paying a bill that you cut in after June 10th, which is like a water bill or an excise tax bill, you have till June 30th to pay those. You can mail online by going to leominster-ma.gov. You can mail it, and you can also go to the top stairs at City Hall on the right-hand side is a mailbox, and you can throw it in there. Gyms, we don't know yet. Anxiously awaiting, right? Anxiously awaiting. Thank you, Megan, for finding that information. So 40% with at least one and 60% without. So that's better than we thought. But as time goes by. And there we go with the Comcast Essentials program. This is perfect time. Hey, by the way, nobody really told me what they're doing this weekend. Are you afraid that people are going to tell you should just belong staying home? But I know people are going to go out. We just want to make sure they do it safely. And if you're going to visit one of our trails, that you do so and in a respectful manner. so that you take any trash out that you bring in, and just pay respects to Mother Nature. So Comcast Essentials program, if you don't have internet access and you haven't had it with Comcast for 3 months, they'll give it to you for free as long as you meet some eligibility. And 1-855-846-8376, motorcycle riding. There you go. Good job, Fran. Where you going? Anywhere special? So 1-855-846-8376. Tornado watch. My daughter's a fanatic about weather. Pool time, like swimming pool. So tornado watch until 10 o'clock tonight. Tornado watch until 10 o'clock tonight. And if you're watching this, it's Friday night. So if you catch this later on Sunday or something on a repeat, you know that. And Ronnie Gerard's going to film some more downtown. Boy, he's been doing a nice job taking all those pictures and filming. Stimulus checks are coming. If you, a lot of people I talk to still haven't got theirs yet, but they're coming. And Veterans Project, we're looking for people to help with flagging of the cemeteries. So you want to reach out to the, I think we got an extra slide. I'm not going to do it. We have a slide here, I think. You have a swimming pool open? Is it heated? A heated swimming pool? That is cool. Get those leaves raked up. Get those leaves raked up. You got to the 30th, and don't come yelling at me. The 30th, they got to be picked up. If you want to enter our contest for the most amount of leaves, so you win a bunch of prizes, take a picture. Send them to me. Leominster, D. Mazzarella at leominster-ma.gov. Dog licenses renewals have been extended to June 1st. And don't forget, Leominster's old-fashioned bargain days / sidewalk sale, June 26th and June 27th. And yeah, that's the time we'll all be out there getting those great deals. Registry of Motor Vehicles next week. 857-368-8000. They do have some registry open. Lawrence and Worcester are open. Boston and Fall River and Brockton, Plymouth and Pittsfield and Springfield are open, but they've pretty much extended everything. But if you have questions, go to the website first. Always start with the website first, and then if you can't find anything, then get on the phone. The one good thing is you can take your phone with you, right? And then pull over when finally somebody answers. I need my glasses. There's your numbers. Don't forget, you can go to our website, leominster-ma.gov, and find all this information. Your friends will think you're so smart. They won't even ask you for your IQ because you've got all the answers right here, right on our website. Online shopping, these are the businesses that are still open and doing sort of, video and, teaching with classes, video, doing deliveries. You can order online. So there they are. Dr. Mazzarella says, assume you have the virus, assume everyone you come in contact with has the virus, assume every surface that you touch is somehow or another compromised. And I forgot my stethoscope. I had to do a quick assessment before I got here, so I forgot it in my car. And let's see, yeah. So assume every surface has somehow or another been compromised, so I need to clean those surfaces. Also remember to wash your hands, avoid touching your eyes. Now you're going to want to touch your eyes, your nose, and mouth. Clean things frequently, cover your mouth when sneezing. Stay home if you're sick. Think ahead about caring for others. Be the care. Huh? I made that slogan up last night. Be the care. And don't forget to wash your hands, and when you can't, hand sanitizer. This is a virus we're giving to each other. So 6 feet distance. Anybody's coming closer than that, you don't have your mask on, tell them, wait a second, pop this baby on. First of all, I wouldn't let them get that close. But if you do, you end up in a situation, you're at the grocery market where you're required to do this. But any other situation, just pop your little mask on. We'll be giving more out on Monday at Emergency Management, 37 Carter Street, and also 25 West Street at City Hall. Thank you to all those private sector folks who we've got a list. It's much longer than this, but we'll be thanking them all. Senior hours, call first to check. Everybody's got a different thing. Restaurants and takeout happening tonight. And, happening tonight. So Don't wait till like 5 minutes from now when I'm going to run downstairs and see what's cooking. But yeah, St. Cecilia's Parish is inviting the public Sunday between 1 and 2 to wish Father Brusso a happy 70th birthday. And I'm going to read that. They will be filming. So do you know where they're meeting? If anybody wants to post that information where they're going to be meeting. Okay. So we just got some more masks. They arrived at Carter Street for Monday. So we got another. Thanks to our donor who doesn't want to be acknowledged, but a good friend of mine. We worked on, believe it or not, we never knew or thought that somehow or another our paths would cross. I mean, we're still friends and everything, but we didn't know that we'd be attacking a sort of global situation like this. But we both worked on the AIDS projects in the, I guess, 80s and 90s, and worked feverishly on both of those projects. So we're back as a team again. And as we said to each other just earlier today, who would have thunk? Who would have thunk? So if you're going to a restaurant, take out, find out if they do delivery. But I know on Friday and Saturday nights, sometimes they get so busy they can't even answer the phone. So keep that in mind. Plan ahead, right? Plan ahead. Sit down and put the menu together. Call ahead. And there's our list of those takeout and delivery businesses. So again, go to our website, leominster-ma.gov. Also off-premises sales of alcohol. They know the rules, right? Just in, flagging of the cemeteries, 519 at St. Cecilia's, Evergreen Cemetery, 521, St. Leo's, 521. And so for more information, you can read it here on our Facebook account, and we'll also be sharing that. I think I shared that earlier. Pasta Land for dinner tonight, and that sounds good. I went last week. We did that for Mother's Day for my mother. And it's just, if you're not, either make it yourself or get over to pizza. Yeah, either that or get over to Pasta Land. Okay. So those are the participating businesses. Hey, what do you think? I think Kimball's is going to open tonight for ice cream. Not sure if that's true, but I heard that. That'll be interesting to see how, and that guy's got it figured out. There's no flies on him. And don't forget, if it's a nice weekend, you want to bundle up if it gets cool and windy, but, you know, dress appropriately. The mayflies are out. Mosquitoes are starting to come out. Plan ahead, right? Plan ahead 26 miles of hiking trails. Leominster-ma.gov. You find out anything you need to know about our hiking trails, where to hike. Barrett Park, Carter Park, Monusnock, Greenway, all those places. Doylefield, don't use the equipment, please. Keep your distance. You see somebody you know, give them a little high sign. Peace. And the census. If you haven't filled it out, please do. Leominster is a little bit higher than the state average and the federal national average, which is 61% and then 63% with the state. Oh, so we're at 66%. State's at 61%, and the federal government is at 53%. So we still have 33% of the population of Leominster. We need to know. We need to know exactly who's out there. It's very important for funding. That's our way of convincing you that you need to. Look at my hair, what a mess. Man, oh man, I can't wait. I'm gonna just a little trim kind of thing. I'm not gonna cut it off. Or maybe if there's a good cause, I will. But I don't look good. You know, see my squash? It's like disproportionately made up. It's weird. I did it before for a fundraiser. And some people look really good without hair. You know, they buzz cut, they look good, and I'm not in that category. Okay, masks next week, 8 to 4 at Emergency Management, 9 to 4 o'clock at City Hall. Thank you, everybody. It's been a long week. It's been a long, in some cases, 9 weeks, I guess 10 weeks technically. And so thank you for your patience and your kindness and everything else in between. And thank you to our crew at city government. They are trying, believe me, whether it's from home, from the offices, from wherever they are trying hard to keep this machine moving and get you what you need. And birth certificates for, you know, the registry didn't post that they're extending the license renewals. So that made a whole group of people come to City Hall looking for birth certificates and marriage licenses, and we are continuing to move along. We haven't held up any inspections. We haven't held up anything for city government because the backup later, when everything gets going again, you're still going to be backed up. There's nothing worse than that. You never can seem to catch up. So yeah, a salute out to them, all our essential workers, no matter where they are and what they do, are part of the team to keep the engine moving and keep the city in the condition that it's in. So thank you. And to all those in public safety as well, be safe out there. Those nurses, I mean, it's been 10 weeks for you. I'm going to bring in my mask next week, one of those big masks they wear in the hospitals, just to show you all the little straps that they have to wear. And they do that for like 8, 12-hour shifts. Okay, yes, we appreciate every one of you. Thank you for your patience, really. That's really what's made it easy for us. And remember to wear your masks. And if you can you're going for a run or for a walk and there's nobody around, but, just fold this baby up, put it in your top pocket, and when you need it, you just pop it out of one of your pockets or something. Or just, like eyeglasses, the reading glasses, you just got to let them hang here. Find a little stretch device in the back. You'll be in good shape. Okay, we will see you. We'll do an update tomorrow if we need to. And Wendy did post the daily results here in Leominster, down just 1, but up in a significant way in terms of those coming off. So we will, again, update you if we need to on Saturday and Sunday, or we'll just post the results. Or if it snows again, it might be back on again. So watch the weather tonight. It could get a little dangerous, but we don't want to panic you, just get you prepared. Thank you to Keith and Bradley and everyone who comes in all of the time to make sure that we can do this and make this possible so that you can see this on cable TV. Good night, everybody.